Hi, welcome back, future nurses. I'm Dr. Kathleen Jude Estime, a psychiatric nurse practitioner, and I'm on my journey to become a certified nurse educator. Today, we're tackling endocrine for the NCLEX scenarios. It's one of the really vital areas we need to master. And remember, whether you're studying with my NCLEX coloring book, digital products, or just joining my tutoring sessions or going live with me, we're building a community and you're building your confidence until you pass. Question 1, critical thinking and safety. A client with hyperglycemia presents with a blood glucose level of 400 and is confused. What's the nurse's very first priority action?
Pause and think. Do we check for ketones in urine, administer insulin, or assess their level of consciousness first? Always remember, client safety is priority 1. Addressing acute changes in consciousness and blood levels is crucial.
Question 2 is in therapeutic communication. A client with diabetes expresses frustration, saying, "I can't keep my blood sugar stable." Which nursing response is most therapeutic?
Hint, provide empathy and encourage them to share their feelings without giving unsolicited advice or minimizing their concerns. Teaching moment. Therapeutic communication is key on NCLEX. In my coloring book, I provide scenarios to help you practice these skills.
Question 3, medications. Your client with hypothyroidism is prescribed levothyroxine. What key education should you provide regarding this medication?
Okay, think about it. Think about the importance of taking it on an empty stomach and monitoring for signs of hyperthyroidism, such as increased heart rate or anxiety. Teaching moment. Medication knowledge is essential for NCLEX. My digital resources break down drug actions and expected side effects into easy to use charts.
Question 4, delegation and scope. When caring for a client with Addison's disease, which task can the RN safely delegate to the LPN?
Hint, RNs handle assessment and teaching, while LPNs can monitor vital signs and administer medications as directed. Teaching moment. Delegation scenarios are high yield for NCLEX, and I cover these extensively in tutoring to ensure you're confident.
Question 5, assessment skills. A nurse performs an endocrine assessment on a client suspected of having Cushing's syndrome. What key signs should you look for?
Correct. Watch for weight gain, moon faces, and signs of hypertension. Teaching moment. Assessment skills are fundamental and will frequently be tested. Practicing with scenarios help reinforce your learning.
Question 6, complications. A client with diabetes presents with ketones in the urine and a fruity odor to their breath. What complications should you be most vigilant about?
Think about the potential for diabetic ketoacidosis and the need for urgent medical interventions. Teaching moment. Understanding complications is vital for NCLEX. My guides include common scenarios and management strategies to prepare you.
Question 7, patient education. What key teaching point is essential for a client newly diagnosed with type 2 diabetes?
Remember, they should understand the importance of lifestyle modifications, including diet changes and regular exercise to manage their condition. Teaching moment. Patient education is a frequently tested topic. I emphasize these areas to help you remember important teaching strategies in my resources.
Hi, if you found these questions helpful, don't stop here. You can grab my NCLEX endocrine coloring book, download digital study guides, or sign up for our tutoring. And remember, my NCLEX review program includes weekly TikTok lives and Sunday Zooms. Stay with me until you pass. Visit the link tree in the bio to get started. See you in the next episode, and remember, you've got this.